Good morning, everybody. This is Dr. Brace here. It's Facial Plastics Friday, and today I'm going to talk about Botox. We're going to start a two-part series, the good, the bad, and the ugly. Today is the good, next week is the bad and the ugly. And so as a quick refresher, what is Botox? Botox is a brand name for botulinum toxin. There's also Dysport and Xeomin in Canada, and they're all type A botulinum toxin. They're neurotoxins or neuromodulators, and what that means is that it is a drug, a protein that stops muscles from contracting. It blocks the nerve signal to the muscle that tells it to contract. So essentially at a high dose, Botox or Xeomin or Dysport is a muscle paralytic, and at low doses it's a muscle relaxant. And so the way it works is that you put it in the muscles that are making the lines or the wrinkles that you don't like, and it will relax that muscle or paralyze it so you don't make the lines. All of the products are temporary, so they are not a permanent effect, and for most of them, it's somewhere around 10 to 14 weeks in terms of the duration that it will last. The longer you use a neurotoxin or a neuromodulator, so if you've been doing it, 4 times a year for the last 2 or 3 years, your muscles will atrophy, they will get smaller, and you can go longer periods of time before needing treatments because the muscles won't recover as quickly. But there's no long-term lasting effect from doing neuromodular treatments for years on end. All you're essentially doing is just preventing the muscle from contracting, so your wrinkles don't get worse afterwards, which is a common question. So let's start off with the good. What do I like using Dysport, Botox, Xeomin for? In my opinion, this class of medication is best for the upper third of the face. So the upper third is basically from your glabella to your hairline. Glabella is that space here between your eyes and your eyebrows. So I have Botox in my forehead. So I like to dose Botox or Xeomin or Dysport at a low dose because I find that it softens everything without causing heaviness or lack of expression lines. You want to be able to express yourself and still look human and not just look completely flat. So when I raise my eyebrows, you can see that I don't make deep lines. That's because I have 5 units of Botox in my forehead. I also put it in my crow's feet, so when I squint, I don't make deep lines. Now, a lot of people ask about these lines here when we smile, and we'll talk about that next week in terms of the bad and the ugly. The other place that I like it in the upper third is the glabella. There are 3 main muscles in this area. There's the corrugators, which go like this, and they cause you to get those 11 lines, the scowl lines. And then there's the procerus muscle, which runs up and down your nose here, which gives you the horizontal lines. And so when I scowl, that's as much as I can do because I have product there. And so the good of Botox or Dysport or Xeomin is that it relaxes those muscles, it takes away the deep etched in lines, and makes things look more relaxed, more refreshed. I love it for the upper third of the face. This is where it shines. This is where it does the best job. Off of the upper third of the face, the depressor anguli oris muscle, which pulls the lip down, is a great muscle to target because if you have a downturned mouth, you can hit that muscle and it will relax it and let the corner of your mouth come up. And that's really the only place I like putting cosmetic neurotoxin in the lower face. Next week we'll talk about why in terms of the bad and the ugly of placing it in the lower eyelid, of placing it in the upper lip, and other places in the neck. But that is what I like to use cosmetic neurotoxins for, the upper third of the face and the DAO. I guess one other spot would be if you have a very dimply chin, you can put it right in the chin and it can help with the chin dimples. But aside from that, I don't like the product in the mid-face at all because of some complications that can happen. So send us your questions on Botox. Stay tuned for next week. We'll talk about the bad and the ugly, the places you can put it and get a cosmetic result that you won't like in terms of function, or where you'll get a bad cosmetic result. Everybody have a great weekend. Bye-bye.